Hello, I am Dr. Ahilasamy from Chennai. I am going to show a post-operative care after FESS surgery. This is a bilateral maxillary pathology, polyp and cyst and antroconal polyp with fungus on the left side and right side cyst. This is a post-operative image on the left side, that is, and this is on the right side immediately after surgery. So, from the second post-operative day onwards, we ask the patient to douche the nasal cavity thrice a day with saline or 1 liter of salt and 1 liter of water and 1 spoon salt and 1 spoon soda bicarb, that is baking soda. This is a diagnostic nasal endoscopy on the 7th post-operative day. This is done on OPD, and we always ask the patient to come on the 7th post-operative day for the nasal endoscopic cleaning. This is a diagnostic endoscopy. You can see crust in the middle meatus area, but otherwise septal mucosa, lateral wall, everything is absolutely fine, no sinecane. We pack the nasal cavity with a cotton wick. You can use roller gauze or neuropathy soaked in 4% lignocaine and adrenaline in the ratio of 2:1. That is 2 ml of 4% lignocaine and 1 ml of adrenaline. And pack it and keep it for 10 to 15 minutes to wait so that the thick crust gets softened and melt. Then we take the patient for the endoscopic cleaning. You can do it in lying down position, but I used to do in our OPD sitting chair position itself. Pack it nicely in the middle meatus area and patients are very comfortable. After 15 minutes, I am just rubbing removing the crust and taking out the pack. For the second post-operative, 7th post-operative day, you can see a lot of crust coming along with the gauze. We ask the patient to douche the nasal cavity 3 times a day, then next 1 week 2 times, and the next 1 week 1 time a day like that for 3 weeks. And after douching, we tell the patient to blow the nose well so that the crusts all fall off. So the pack from both the nasal cavity has been removed. Then I use the suction to suck out the crusts, which shall be melted. See, now I am using the suction to suck out this debris. So again sucking, this on doing on the left side, hardly any sinecane. It's a mini FESS, that is upper two-third of the uncinate has been left behind, so no chance of any sinecane. And a very wide MMA. This patient had a left side fungus, polyp and an antroconal polyp, multiple antropolyps. This is on the 7th post-operative day. Hardly any sinecane, and we don't pack the nasal cavity after all the FESS surgery. So the mucosa is very perfect after surgery, hardly much crusting or sinecane. So what is being sucked into the suction. Now I am coming to the right side to suck out the secretions. Straight section. Of course, I sometimes use an angled sucker also. All this pent up secretion within the maxillary sinus, it's coming out into the suction. There's a small mucosal tag hanging. You can leave it, but I will remove it with a upturned cuff forceps. Like that, small tags here and there. If you see post-operatively, you can remove it. Already you have kept 4% adrenaline pack, so it has been anesthetized. Patient is very comfortable. I am using the upturned Black's cuff forceps to take the tag out. If you have a shaver system ready in your OPD, you can use that also. Of course, I don't keep shaver system in OPD. But the most important thing is patient douching the nasal cavity from the second post-operative day next for up to 3 weeks post-operatively. The tag has been removed with a saline solution or with a salt and baking soda added to 1 liter of warm water, and flush with a sucker, red rubber bulb or a 20 cc syringe. Thank you. See you in another video soon.